and the various questions related to the virus and the potential for transmission in Allegheny County, we want to share the steps that the Health Department is taking, along with its partners, to prepare for any community spread of COVID-19, as well as what residents can do now. A lot of work has been going on behind the scenes at the Health Department to assure that we are prepared for a possible outbreak. Our personnel have been closely monitoring the outbreak and have been involved in frequent briefings by the Centers for Disease Control and Prevention and the Pennsylvania Department of Health. Health Department leadership has been providing briefings and guidance to many of our community partners, including emergency service providers like Chief Matt Brown from the county and Director Wendell Hisrick from the city of Pittsburgh, who are here with us today. First, let me turn the podium over to Dr. Kristen Mertz, a public health physician and medical epidemiologist for the Health Department, to discuss what we know today about COVID-19. Dr. Mertz?
While some coronaviruses are common throughout the world and cause mild illness, COVID-19 is a new disease caused by a new coronavirus not previously seen before in humans. It is a respiratory disease with symptoms including cough, fever, shortness of breath, and difficulty breathing. There is no vaccine and no approved medications to treat it. Reported illnesses have ranged from mild to severe, including illness resulting in death. Although the current likelihood of local exposures remain low, we will remain vigilant in exploring possible cases and utilizing the capabilities of the State Public Health Lab, which will begin testing this week. Case numbers are changing rapidly. To date, there are over 30 confirmed cases of COVID-19 that were detected by the U.S. health system, including 2 deaths in the United States. Several cases were acquired in the community with no known travel and no known contact to infected persons. Another 47 people who have been repatriated to the U.S., including those who were on a cruise ship, have been diagnosed with COVID-19. At this time, there are no confirmed cases of COVID-19 in Pennsylvania, but we expect to see some as we expand testing. At present, most people at risk of contracting COVID-19 are those who have traveled to places where the virus is occurring on a widespread basis. Certain people will have increased risk of infection, healthcare workers caring for patients with COVID-19, and other close contacts of persons with COVID-19. Some people are at more risk for severe outcomes, including the elderly or those with underlying medical conditions. While the risk of this virus to the public is low at this time, everyone can do their part to help us respond to this emerging public health threat. First, it's currently flu and respiratory disease season, and CDC recommends getting a flu vaccine, taking everyday preventive actions to help stop the spread of germs, and taking flu antivirals if prescribed. Reducing the burden of the disease from flu will help free up resources if needed for COVID-19. Stay home when you are sick with respiratory disease symptoms. At the present time, these symptoms will be more likely due to influenza or other respiratory viruses than to COVID-19 related virus. Cover coughs and sneezes with a tissue and then throw it in the trash can. If you don't have a tissue, cough into your elbow or your sleeve. Wash hands often with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use an alcohol-based hand sanitizer with 60 to 90% alcohol. Consider refraining from handshakes so as not to pass germs. Routinely clean frequently touched surfaces and objects. High-touch surfaces include counters, tabletops, doorknobs, bathroom fixtures, toilets, phones, keyboards, tablets, and bedside tables. Use a household cleaning spray or wipe according to the label instructions. Routine use of these measures by individuals and their families can go a long way to prevent the spread of illness and help us respond to an outbreak. Thank you.
Thanks very much, Dr. Mertz. As I mentioned, much of the Health Department's work related to the virus in the past few months has been in providing briefings and guidance to many of our partners in the community. So next I invite Dr. Lou Ann Brink, the department's chief epidemiologist, to the podium to share those steps with you. Dr. Brink.
Thanks, Dr. Harrison. So, as mentioned, the ACHD has been in daily communication with state and federal health agencies related to this virus. As new information becomes available, the Allegheny County Health Department updates its information and guidance accordingly. We've been communicating and responding to questions from stakeholders, particularly our healthcare providers and healthcare systems, and those organizations and agencies that have access to large populations. These include schools and universities, businesses and restaurants, and transportation agencies, including the Port Authority and Airport Authority. As many of you know, we've been working closely with the Airport Authority since this virus was first identified. Although our airport has no direct flights from China to Pittsburgh International, the leadership there has been extremely proactive in ensuring that it is doing all it can to limit exposure there. Again, as there are no direct flights from China, all travelers arriving from flights originating in China are screened prior to their arrival in Pittsburgh. We are also working closely with the Port Authority as a means to share information on how residents can protect themselves, but to also ensure that their preparation in the event that we see community transmission of COVID-19 here. For all businesses and organizations, we are recommending that the CDC's guidance is followed. This includes actively encouraging sick employees to stay home or separating sick employees, emphasizing cough and sneeze etiquette and hand hygiene, performing routine cleaning of frequently touched surfaces, and providing disposable wipes for those surfaces to be used by employees. Those traveling should also take certain steps. Be certain that you are aware of where restrictions are currently in place. The CDC is currently recommending that individuals avoid non-essential travel to China, Iran, Italy, and South Korea. Additionally, precautions should be practiced if traveling to Hong Kong or Japan. The CDC has recommended that all travelers reconsider cruise trip voyages into or within Asia. The department continues to work with key sectors, including hospitals and with EMS agencies, on potential responses and countermeasures. If there is community spread locally, there will be a coordinated effort with state and federal health agencies to implement procedures to help stop the spread. Emergency Services in Allegheny County has already implemented measures to identify whether 911 callers seeking help are at risk of having COVID-19. And as you've seen, responders have been provided with enhanced personal protection kits should they encounter someone who has or could have the virus. We thank Allegheny County Emergency Services Chief Matt Brown and Pittsburgh Public Safety Director Wendell Hisrich for being here today, for their continued partnership with us, and for their work to ensure everyone's safety. Thank you so much.
Thanks very much, Dr. Brink. So finally, we are committed to ensuring that we continue to provide the most up-to-date information on the coronavirus. We encourage the public and our partners to use our website as a source of information. There are constant updates on the page, which also directs links to Centers for Disease Control. The URL for the website is www.alleghenycounty.us/ you guessed it, coronavirus. On that page, you can also sign up for Allegheny Alerts. When selecting what alerts you want to receive, select Coronavirus under the Health Department options. ACHD will be providing an update through that system every day at 11 a.m. Finally, if there's any breaking news about coronavirus, the Health Department will push that information out to the public as soon as possible through press conferences, press releases, website updates, and posts on its social media channels or alerts through Allegheny Alerts. So with that, that is the end of our comments, and we have a few minutes to address any questions.
In regards
Yeah.
to,
Go ahead.
Who will be making the call for school closures or university closures?
Kristen?
So if we do have widespread COVID-19 here, those kinds of decisions about school closures, of course, will be made by the school district, but they will be made in conjunction with the health department. Universities are free to make their own recommendations for their students, but there is guidance coming out from CDC to help them, have recommendations that are consistent with the national recommendations.
Okay, so to start, it would be district by district.
Case-by-case basis, yeah.
And then down the line.
Correct.
If
Yes.
you have any of these symptoms, cough, fever, shortness of breath, how do you get tested and what's the appropriate time to get tested, and then how long does it take to get those results back?
So testing so far has been relatively limited because of the distribution of test kits, but that is changing. So you have CDC pushing out the test kits to the health departments, state health department, and then FDA is now expanding the ability of hospitals to also do testing for this virus.
So a person will go to the hospital, go to their doctor and ask for it? How would they?
When tests are available, then they can be requested, but it's going to be based on criteria that are put forth. But testing, the bottom line is that increased testing will become available in the near future.
So you have a symptom, you go to the hospital, and it would be at the doctor's discretion. I'm just trying to understand.
It'd be at the discretion of the healthcare facility or the healthcare provider. Yes.
What kind of conversations have been had with Pitt? At least example?
Yes. Dr. Bush wanted to comment.
I just want to say one thing about testing in the public health system. So currently, only public health system labs are testing, and to get tested at the state health department now, you need approval from the local health department. So if providers have a suspected case, they need to contact us, we need to approve it, and then it goes to the state lab. And the process is probably about 24 hours. It takes 4 to 6 hours to run the test, but it has to get there, et cetera. So.
What kind of conversations have you been having with Pitt? I believe some samples went there, if I'm not mistaken. Any information come from them, from their labs at all? Or?
Kristen, do you want to comment on communications with the University of Pittsburgh?
So we are in touch with the universities here, and we are relaying to them the national guidelines and our guidelines, but they, as I said, are free to make recommendations for their own students.
Have there been any cases that have been tested from Allegheny County, and/or have there been cases evaluated to be tested that were rejected for testing?
So yeah, we are not, the local health departments and the state health department are not commenting on how many people are being evaluated or tested. We will only report on confirmed cases.
Why not talk about the number of tests evaluated?
Just because it's something that changes the number evaluated is just hard to keep up with. We get many, many calls from the public and the providers. We don't think there's any real need to know unless there's a confirmed case. Like, there's no reason the public needs to know who's testing negative for the disease.
Given the stories coming out of the CDC about the problems with the testing itself and the lack of kits, especially coming out of Washington State right now, where there's an analysis that seems to point to this virus lingering there for the last 6 weeks, possibly being transmitted. Do you think, based on what you know of those cases that at least were proposed for evaluation, that that could be possible here? You know, we've had multiple stories. Locally, there's a large immigrant population here, specifically from Wuhan. CMU and Pitt both responded to that. That community itself self-policed in many cases, as you know. Do you think that there is any chance that we have had cases here that were testing more available, would have been testing, we might have picked it up? Can you put any finger on that?
We don't know for sure, but we know that because of the limited testing so far, that there most likely has been community transmission in a lot of different places that we haven't recognized yet. Well, we don't know, and that's what we'll find out as testing becomes more available. But this is a rapidly changing situation. As test kits become more widely available, I suspect we are going to find more community transmission.
On that note, how quickly are you hoping to have test kits here in Allegheny County?
So we are looking into getting test kits. It probably won't be for a few months for us to get them here unless things change. That was the last update I hear. But the State Health Department is starting to test this week, and we can get them we can get specimens to the State Health Department overnight. And like Dr. Harrison said, hospitals will start to come on board very quickly, and commercial labs might come on quickly as well.
So just to follow up on that, in terms of getting, would it be more helpful in terms of trying to deal with this if the Allegheny County Health Department had their own test kits as opposed to having to send potential cases that are then approved to the state?
I don't think it'll be a huge difference. I mean, we would have to approve the testing in any case, either way, state or here. So it might be a little bit faster if it were here, but then we have the hospitals and the commercial labs too.
So you're saying that hospitals here will soon have these latest tests?
Yeah.
It's my understanding that hospitals will start to develop their own testing.
What's soon?
I don't know. This is a rapidly changing situation, and the FDA has recently liberalized the ability of hospitals to do that. So
when Dr. Merck says a couple months, she means the county health department? County health department.
And can you tell us more about what the airport has done? They've only given out vague responses about what they've been doing there specifically. Can you tell us what they have done to monitor traffic in and out of the airport? Are they doing a second layer of testing there? Are they tracking people when they come through, when you know that they've come from now one of the four countries, or I guess 7 if you count Singapore and Hong Kong?
We don't have any direct flights from any of those countries into Pittsburgh International. However, we do have quarantine stations that CDC has infrastructure through the larger airports, and there are records as to where various people have come from. So those records are maintained through CDC quarantine.
Do we have quarantine here?
The closest one is Philadelphia.
So what happens if somebody, layover?
Excuse me, we realize there's a lot of interest on what everybody else is doing, but we need to focus on what the health department is doing. That's what we're here today to talk to you about, so we can't speculate about what everybody else is doing.
But you said that you're coordinating with the airport, so what are you doing with the airport? If the quarantine spaces are in Philly, what is the airport here doing to coordinate with you in any way?
We have had multiple conversations with them about incoming travelers and what they would do with ill individuals. These are routine procedures that have been going on more or less for the past decade. We've been coordinating responses with them since that time.
And local hospital systems told you they have started developing, trying to come up with their own testing individually?
This is just based on general information and the liberalization of the ability of facilities to do that. I have no more specific information at this point about specific hospitals.
Skilled nursing facilities, obviously the one in Washington was impacted. What are you doing to protect the skilled nursing and senior facilities here?
So we are in touch with long-term care facilities via conference calls and emails, and we are sharing CDC's guidance with them on how to respond to an outbreak of novel coronavirus disease. There are, luckily, a lot of the measures that would be applicable to an outbreak of COVID-19 are similar to the outbreak measures for flu. So, as you know, long-term care facilities have quite a few flu outbreaks, and so they're pretty well versed in how to respond. So we are sort of reviewing all the procedures with them, and they're gearing up to even more stricter, same type of, cohorting patients who are ill, testing paid contacts, reducing activities, keeping ill people in their room, checking staff, keeping ill staff out of work, no visitors, signage. There's a whole host, a long list of responses that long-term care facilities can take to reduce the spread in their facility.
People who are older are more at risk for COVID-19/coronavirus, so kind of along those lines, is the county recommending our older residents to do anything in particular, especially because Allegheny County's population skews older?
Well, right now we have no known cases, so we have no specific recommendations for elderly. I mean, we do want all elderly to get a flu shot, and that will help cut down on the confusion of whether they have flu or whether they have coronavirus if fewer people are getting flu. But obviously, they are at greater risk. They're going to have to be constantly hand washing and, be more on guard because the death rate in the elderly is higher than it is in...
I know you mentioned there's no vaccine, but is there one in the works, and do you know that information?
There are a number of different companies and governmental agencies that are working on vaccines, but typically, getting a vaccine tested for safety and immune response, and then field tested for, hopefully, does it actually protect against disease? That can take a while. So clearly, this season, it's unlikely we're going to have a vaccine, but there's a lot of people who are working on that.
This is more of a question for public safety. Are you taking questions at all? Sure. I'm just curious, what conversations has public safety been having on this, on the police end? I don't know if there's anything at all you guys are elaborating on, if you're just having these early discussions.
No. It began about February, the beginning of February. We started preparing through EMS both web-based and hard copy training for all the first responders in the city of Pittsburgh. Since that time, we've also been working with our partners in the county with the suburban EMS, and I'll let Chief Brown handle that. We have pushed out to the police officers 1,000 personal protection equipment bags, which include eye protection, which include the N95 mask, which includes sets of gloves and hand sanitizer. Fire, we've pushed out additional personal protection equipment. They've already had it with their day-to-day operations as first responders, and of course EMS. We have worked with schedules. If in fact an onslaught of call volume arises, we're going to put additional medic units on the road. We may also put, in addition to the medic units, an assessment team to be able to go out and assess individuals that are complaining of signs and symptoms of either the flu or the coronavirus. So it's an all-inclusive approach throughout the city. In addition, even the school crossing guards have been provided bags of personal protection equipment, as well as our park rangers. We're also working, our main goal is, number one, to make sure that the first responder community is safe, and to make sure that they are able to do their jobs. I think that we may already have seen that the individuals, the first responders that responded in the state of Washington, have been quarantined. I believe it's 12 to 20 firefighters have been quarantined, so we have to prepare for that, and we have a plan in place that if we have to, we'll cancel past days, we'll add additional personnel, and increase the hours worked.
Are there certain officers or certain staff members that have been notified, hey, in case, things intensify, you will be called in, maybe a rotational schedule or something?
We have not. Every day officers are told that, public safety is unpredictable, and every day they come to work, they know that they could be held over. The fortunate thing about this, it's not a fast-moving in our definition that, things are going to change in a matter of 2 or 3 hours. Hopefully we'll have 12 hours to 24 hours notice of putting on additional personnel. Chief Brown, do you have anything additional to add?
No, I would just add to the director's comments. From a county-wide perspective, there are 30 EMS agencies throughout the county, as well as literally hundreds of other public safety entities. Working through our National Incident Management System, the NIM system, our ESF4 or ESF8 function, which is really health and medical section. From an emergency management perspective, that is where we would get the guidance moving forward as public safety, and certainly we will function that position with the help of the Allegheny County Health Department. We have put together, working with the City of Pittsburgh and our EMS partners, initial responder training for all of the emergency agencies throughout the county. This was done weeks ago, and we even began pulling the trigger much sooner as it relates to 911 and screening questions based on 911 calls that were coming in. That was almost a month ago. So again, we continue to transition as it changes moving forward. And again, speaking to the director's comments, these are public safety professionals that, quite frankly, are dealing with this and many other challenging things every day. So I don't think that we're doing anything drastically different from what they deal with on a routine day.
Just a quick question for some of the health department officials. There was a issue with a run on masks we were seeing a little bit earlier. Is there any sort of advice you'd give to the public and any sort of concern that there may not be enough surgical masks or masks needed to protect healthcare professionals?
my understanding in the community is we have a large stockpile of personal protective equipment, and that's not an issue at this point for our healthcare providers and first responders. Kristen, did you want to make any additional comments?
Yeah, I would just say that the general public has no need to wear a face mask at this time, so we would appreciate if people didn't hoard face masks and leave them for when people are sick. The people who need to wear them are patients who have respiratory symptoms, and they wear them to keep from spewing germs out, so there's no need for the well public to wear them.
One of the things you guys have constantly mentioned, wash your hands. And granted, hand sanitizer is not necessarily an expensive thing. Is the health department making it available for people? Are there kits that are going to be put together if people want to swing by and have that extra stock of hand sanitizer?
Yeah, we've asked our business partners to think about putting that out in the lobbies, including any public venues, to increase availability of hand sanitizer, and we are working on some mechanisms to make it available, not to individuals from the public, but to those public venues.
Has there been any additional monitoring procedures, either for flu or COVID-19 in the jail?
Kristen, did you have a comment about the previous question?
No, I was just going to say that soap and water should be available to everyone, so sing Happy Birthday twice. That should get you for 20 seconds. I've also heard that if you do Baby Shark song, you got to get to the father. So those are pieces of advice.
Great advice. Yeah. I'm sorry, what was the question?
Any additional monitoring for either flu or COVID at jail?
Yeah, so we have been in touch with the jail, and we have sent them some guidance, and we will be sending them supplies for their healthcare workers should they start to get cases.
Obviously, you don't have a crystal ball, but do you have any informed projections as to when we could potentially see this spreading to our area, days, weeks, months?
Nobody knows. I think once testing becomes more widely available, we'll have a pretty good idea. But there's no way to know with any certainty exactly when we're going to see transmission here. But again, I think the general notion is that there's probably a lot of transmission going on in the country, not specifically here, that we don't know about yet.
We have time for one or two more questions.
Are there any concerns about large-scale gatherings? You've got the Homeland show starting later this week. Headspace working on stuff. Are there any concerns about that?
Did you guys want to comment?
Not at this time, as there's no evidence of any community transmission here in Allegheny County, and as I said, we're in frequent contact with the state, and we'll have a really good idea should something like that begin. So at this time, we are recommending, again, that hand washing, the good cough and sneeze hygiene, and please don't go to those events if you are sick. We are working with those venues to talk about additional hand sanitizer, but as Dr. Mertz mentioned, washing your hands really is the way to go.
We have time for one more question.
Can you update one of the things that was made of today was the distinction between coronavirus and the flu, and people are more likely to get the flu. Can you run down some stats on how many people have been sickened, how many have been deaths, what the percentage of effectiveness is?
Well, so that's a really good point. So right now, the biggest risk in the community is influenza. We're in the middle. We're probably starting to tail down, but we're in the middle of the flu season. There have been somewhere on the order of 5,000 deaths from flu in this country so far this year. Over 100 children have died from influenza so far this year. So in terms of current risk, the best thing you can do is get flu vaccine. Flu vaccine varies by strain, by year, but it's not a perfect vaccine, but it's quite effective in preventing severe outcomes such as hospitalization and death. So flu vaccine is really important.
And the deaths here in Allegheny County?
Yeah, as of today, we have over 11,000 flu cases reported, and of course that's just the tip of the iceberg because a lot of people never get tested, never go to their providers. We have, I think it's 127 hospitalizations and 12 deaths to date this flu season.
Thank you.
Okay, thank you very much, everybody. Thank you.
All right, so you've been watching a live briefing, live update from several county officials, county health officials on the coronavirus. I think a big takeaway is there are still no confirmed cases here in Pennsylvania, but officials said as time goes on, as testing continues, they do expect that to change.
And one of the things they noted is that right now the test kits are not readily available to everybody. They do hope, the Allegheny County Health Department says that they hope to get those test kits within a few months here. Right now, a lot of that is going through the state health department, and they also wouldn't comment on the number of people who have been tested. They say they're only going to tell us if somebody actually does have a case.
Yes, and in the meantime, a lot of agencies are working together. Port Authority, airport, working with health officials. I thought it was interesting that they said EMS officials are being trained so that if a 911 call comes in and there's any sort of suspicion that someone could have the coronavirus, there are procedures in place.
And best thing they say to protect yourself, wash your hands. If you don't feel well, don't go to work, don't go to school, and then sanitize anything that a lot of people are using, like keyboards, something like that.
Yes, yeah, a couple of other things. They said avoid travel to certain areas. China, of course, Iran, they noted as well,
South
Italy,
Korea,
several other countries. Yes, yes.
So Aaron Martin, you heard him asking some questions there of the county health department. He was there covering that, so you can look for more coming up today at noon. We certainly appreciate you joining us, and make sure you download the Breaking News app as well.
Have a great day. 13-year-old was also in the line of fire but wasn't hurt. Now, investigators are still searching for the shooter, and they're asking witnesses to come forward. The shooting happened Sunday afternoon near Fremont and Jenny Lynn Streets in McKeesport. Police say a 19-year-old victim was shot while sitting in a car with another man and then a 13-year-old when someone outside the car started shooting. Meantime, a Pennsylvania state trooper doing okay, thankfully, after he was shot during a traffic stop. It happened Saturday morning in Franklin County. State police say they tried to stop a driver who was believed to be under the influence. Troopers did a field sobriety test, and that's when, take a look here, this man, 20-year-old Robert Ransom, pulled